Why is the immune system attacking the tissue? Now, there's multiple potential reasons why it happened, what triggered it in the first place. Genetics could be a component. We could see things like leaky gut disease, infection patterns. You can see things like hormonal surges. There's different things that could be potentially the triggering of that immune system, but you're not going to stop that. There is no cure for autoimmune disease. What has to happen is what needs to be done to balance out the immune system to potentially stop or arrest the attacks. So the focus needs to be on the immune system, and not only on the immune system itself, but what else beyond the immune system that is triggering a response I refer to as triggers or antagonizing the immune system to tell it to attack the body. Because here's the thing. Let's say you have lupus, right? You've got a lupus condition. Now, the problem is the focus is now immune suppressors, steroids, those sort of things, is to address the symptoms in that traditional model. The issue is when you have one autoimmune, you are at risk of developing future autoimmune. So if you're dealing with, say, a liver autoimmune disease, biliary cholangitis, or primary hepatitis, autoimmune hepatitis, whatever it might be in regards to the diagnosis of the specific liver or tissue, now you know what the problem is, right? The immune system's attacking the tissue, but what do we need to do to find out what is beyond the immune system that is triggering or antagonizing? And that could be a whole slew of things. Let me give you some examples. We can see inflammation. Inflammation could be a trigger, right? Because it creates a toxic environment. We can see underlying issues like blood sugar problems. It could be too low blood sugar, too high blood sugar. We could see insulin resistance developing inside the body that could be a trigger to the immune system. We could see hormonal surges or the insufficiency of hormone production, adrenal deficiency, GI deficiency. We could see food sensitivities. We could see dysbiosis, which is in the gut. We could see underlying infection patterns. We could see toxicities, biotoxins, heavy metals, environmental toxins. I mean, we are talking about a whole slew of problems. Why is this not being discussed in the traditional model? Why are we not investigating to find out what is triggering the immune system to attack the tissue rather than just trying to address the tissue itself and trying to suppress symptoms? We need to move away from the traditional aspect of thinking. Now, of course, some of those things may be necessary because the person may be in a lot of pain and discomfort, but we need to look backwards, 35,000 feet above, if you will, to understand what is causing the immune system or triggering the immune system to attack the tissues. And that is the focus of a functional health doctor. So I'm going to ask you and plead with you to, I know it's going to be difficult because it's been probably ingrained in your brain for so many years that you have to focus on the tissue and that specific problem, but I want to invite you to start looking beyond that. Look further back. Be a 4-year-old again, asking the question why. And keep on asking the question why until you get the right answer. Traditionally, if you ask the question why in a traditional model, you're not going to get the answers you want because they don't know. It's not in their model to address the underlying mechanisms. It's in their model to address the symptoms or the disease process in regards to using a pharmaceutical drug. There has not been a pharmaceutical drug that is shown to basically fix a problem. We all know that because if there was, then you would only need it for a period of time. I guess maybe antibiotics could be a potential one of them that could be because you take it for 7-10 days. But other than that, when you're taking a medication for, say, your thyroid or for blood pressure or cholesterol or what have you, the expectation is you're expected to take it for the rest of your life. So if you're expected to take it for the rest of your life, how is it fixing anything? And the answer is it's not fixing anything. It's just trying to slow down or what's referred to as managing the condition. Where if you want to really address these problems appropriately, once you have a diagnosis, that's not the end. And also on top of that, we need to understand what's really the major issue. So just because you may have an autoimmune disease to, say, your thyroid called Hashimoto's, well, there's lots of things that can be done. But don't think it's your thyroid that's the issue. The thyroid is an innocent bystander that's being attacked by the immune system. The immune system's the issue. That's the area, the system that's sick. But then we have to understand, going beyond that, why is the immune system attacking? What on the back end is pushing and driving this force to attack the tissue of the thyroid or other areas that are also being attacked that the person may or may not know about. So hopefully this helps you understand a little bit more about autoimmune disease and the impacts and how a functional health doctor looks at this. And this is why we get such incredible results of patients becoming less symptomatic or even being symptom free, living the quality of life, gaining their energy back, having good brain function, good overall digestive function, reducing stress, anxiety, depression, joint pain, all these things. And of course, many of our patients are also able to reduce their medications that they no longer need because the body is now able to be functioning appropriately. Doesn't matter if you have 1, 2, 3, or multiple autoimmune diseases, your body still has the ability to heal once we discover what is going on, right? So essentially, we have a 3-step proven process that helps our patients. There's a discovery process of finding out what specifically is going on with the individual. And I can tell you, it's never just one thing, there's multiple things. Then there's the optimization / customization. So we're customizing from the discovery process, from the analysis, from testing, and looking deep down comprehensively what's going on with the person. Once we get that optimization, then we want to help them move into a sustainable or continue to excel and live that quality of life for the rest of their life, to continue to be optimal and to live as long as they want in a state of health that they want as well. So hopefully this gives you a little bit more understanding of what's going on with autoimmune disease and how it can impact. And so many of the diseases, we see patients that have thyroid conditions, hypothyroidism, that are actually due to autoimmune, diabetes that are actually due to autoimmune, cognitive decline. I mean, you name it, these things can start to branch off to multiple different types of symptoms that are referred to as diseases. So hopefully this information was worth your time today. If there's something that's unclear, or if there's something you want me to go more in depth into, make sure you comment below. If it's something that requires another video, I will, or I can just respond to you directly. If this is exciting you and you're like, wow, I didn't know there was other options. I thought my only option was to take medications for the rest of my life, and you're interested in talking to me more about how you can potentially be helped, I'll put our contact information in the video. You can reach out. We can do a virtual one-on-one consultation to see if you may be a good fit for what we do within our practice to help individuals. Lastly, I'm going to ask you to make sure you like our page, share the information today. There is someone, I guarantee, in your network of friends and influences that you could potentially help by them seeing this video today. We also have a YouTube video, so our YouTube channel, so make sure you like our YouTube channel. I have lots of videos on there. I'm constantly doing videos on a regular basis to make sure I come up with amazing quality content. So if it's something you're enjoying, please let me know. Or if there's something more you want me to do, I can do that for you as well. Hope you guys have an amazing rest of your day. Hope this was worth your time today. I look forward to seeing you on the next video.